Hello, I'm Richard Gama with UHS Surgical Services. In March of 2014, the Joint Commission announced that it was increasing its focus on laser safety programs across the healthcare industry. This has led to the development of new requirements for healthcare lasers that could impact your facility. Chrissy Reed, UHS's Clinical Programs Manager, will discuss these new requirements. With over 2 decades of experience as a registered nurse, Chrissy has vast knowledge in the areas of perioperative and renal dialysis ICU patient care. Chrissy will now discuss the reasoning for the Joint Commission's increased level of interest in healthcare laser safety.
Thank you, Richard. The actions of the Joint Commission have stemmed in response to a significant rise in litigation from laser accidents and injuries. As a result, additional lawsuits related to healthcare laser procedures have increased substantially and represent a significant financial risk to healthcare facilities, physicians, and non-physician practitioners. This trend is complicated further by inconsistent laser regulations that vary from state to state. For example, in Maine, only licensed physicians can perform laser hair removal, whereas in Nevada, non-licensed personnel with proper training credentials can perform laser hair removal treatments under the supervision of a licensed physician. The regulatory concerns reach across all areas of laser healthcare because of the risk of accidents and injuries during aesthetic and surgical procedures. Laser injuries that result from improper use or lack of physician credentialing can have life-threatening consequences. In California, a healthcare facility had a patient suffer a fatal vascular embolism by a surgeon who was not current on his laser credentials and was not aware of the manufacturer guidelines for use. The California Department of Health did not find the physician responsible for the patient's death. Instead, the chief nursing officer, the laser safety officer, and the chair of Credentials and Privileges Committee were found accountable. The result is administrative penalties to the healthcare facility that start at $75,000 for the first violation, $100,000 for the second, and $125,000 for the third or subsequent violations at the same facility.
In December of 2013, a patient in Washington State was awarded $30 million for a botched laser surgery. The patient was undergoing laser surgical removal of polyps from the vocal cords when the endotracheal tube was ignited, which, according to the malpractice lawsuit, left the patient unable to speak. Use of a laser safety endotracheal tube and knowledge of airway safety procedures would have prevented such a terrible outcome.
The Joint Commission sent out the standards, revisions, and clarifications related to medical equipment and utility system maintenance. An important component of the new standards is that surgical lasers are now categorized with all other medical devices as they relate to maintenance and service. The intent is to ensure all procedures and objective documentation evidence is maintained to the original equipment manufacturer's specifications and intervals. The standards also allow an alternative equipment management program to perform those responsibilities without increasing the risk to the healthcare facility, as long as the program maintains an adequate maintenance and testing frequency in accordance with the OEM's recommendations. Now let's briefly recap the key points of the new Joint Commission standards. First, with the rise of litigation related to laser accidents and injuries, healthcare facilities and practitioners are under greater financial risk. Administrative penalties may be imposed on a facility, and regulatory agencies may, for example, hold the laser safety officer and others accountable for improper laser user training and credentialing. And second, surgical lasers are now categorized with all other medical devices. This means that all surgical lasers must be maintained and documented to the OEM's recommendations. However, this does not mean that only the OEM can perform the maintenance. An alternative equipment management program may indeed be used, so long as the program maintains the equipment to the OEM's recommendations. The effective date for these new standards was July 2, 2014.
This concludes the clinical update on the Joint Commission Medical Equipment and Utility System Maintenance Standards. If you see or hear of any changes in the industry, please feel free to notify us by clicking on the Contact Us button provided on this site. We expect that as we move forward, many regulatory changes will occur. And it is our belief that we can all provide better patient care if we work together to share this information across the healthcare industry. Please tune in again for the next clinical update as we take a look at what you need to do to be compliant with the Joint Commission's Environment of Care standards. Thank you, and Iger Primo.